How can conjunctivitis misdiagnosis lead to chronic eye issues? Imagine waking up with red, itchy eyes and thinking it's just pink. But what if that initial diagnosis isn't quite right? Misdiagnosing conjunctivitis can cause long-term problems because different eye conditions often look similar but need very different treatments. If the wrong condition is treated as pink, it can lead to ongoing inflammation, secondary infections, and even damage that lasts 4 years. One common mistake is confusing viral conjunctivitis with bacterial conjunctivitis. Viral pink usually clears up on its own in about 1 to 3 weeks, but if it's mistaken for a bacterial infection, antibiotics might be prescribed unnecessarily. Antibiotics won't help viruses and can contribute to antibiotic resistance. More importantly, if the viral cause isn't recognized, symptoms can persist or recur, leading to chronic conjunctivitis. Viral conjunctivitis often starts in one and spreads to the other, and improper treatment can cause symptoms to last 4 weeks or even months. Another issue is overlooking other serious eye conditions that mimic conjunctivitis. Conditions like uveitis, which is inflammation of the middle layer of the eye or dry eye syndrome, can cause redness and irritation but requiring different treatments. If these are mistaken for pink, the underlying problem remains untreated, which can cause ongoing inflammation, damage to eye structures, and even vision loss over time. For example, untreated uveitis can worsen and lead to complications like glaucoma or cataracts if not properly managed. Chronic conjunctivitis can also develop from persistent infections, immune reactions, or reactions to medications. Sometimes, the inflammation becomes so long-lasting that it causes scarring of the conjunctiva, a condition known as cicatrizing conjunctivitis. This scarring can impair the surface of the eye, making it difficult to see clearly and potentially affecting eye health long-term. If the initial diagnosis isn't correct, these scarring issues can develop unnoticed until they cause significant problems. Misdiagnosis can also delay recognizing other infections or systemic diseases that affect the eye. For instance, infections like dacryocystitis, which involves the tear sac, or canaliculitis, an infection of the tear ducts, can look like conjunctivitis but need targeted treatment. If these are mistaken for pink, the infection can worsen or become chronic, leading to more serious complications. Persistent redness, irritation, and discharge from an untreated or misdiagnosed condition can also impact quality of life. Chronic inflammation can damage the surface of the eye, making it uncomfortable and increasing the risk of secondary issues. Over time, ongoing inflammation might even influence other eye diseases, such as glaucoma or macular degeneration, by affecting overall eye health. In summary, misdiagnosing conjunctivitis can cause long-lasting eye problems by leading to inappropriate treatments, delaying the diagnosis of other serious conditions, and allowing inflammation and scarring to develop. Getting an accurate diagnosis from an eye care professional is essential to ensure proper treatment, prevent chronic issues, and protect your long-term eye health. If symptoms persist or seem unusual, it's always best to seek professional medical advice to avoid these risks.